Here. Good morning, everybody watching online. We're just a couple minutes behind schedule, so we will kick off very shortly. So, see you soon. Just don't live stream it yet. Have you? Just talking to the people in the room at the moment, David. No live streaming. Um, Good morning, everybody, and welcome to Connect for Mental Health. My name's David, and it's my privilege to chair today's meeting on behalf of Checkup. This is part of our quarterly Queensland Queensland Primary Healthcare Network series. We have 4 of these per year. It's great to see people in the room with us here today. But just to let you know, we've had a record number of registrations today. I think last time we looked, David, it was 380. Which is fantastic. We're happy when we get 60 to 100 people online, but it must be the calibre of our speakers, I think, that has drawn people, and perhaps a new marketing strategy we implemented as well. Whether you're a health professional, a community member, a policy leader, or someone who simply cares about mental health, once again, welcome. Before we begin today, I'd like to acknowledge the traditional custodians of the land on which we meet. From us here in Brisbane, that's the Turrbal and the Yuggera people. Also extend respect to Aboriginal and Torres Strait people joining us here and online. Sorry, I'm out of breath. Been running around all morning. So as I said, the theme today is Connect for Mental Health, and I think it's exactly 1 month to go until Queensland Mental Health Week. And so traditionally in September we hold an event focused on mental health, really to make people aware that Mental Health Week is just around the corner, but also to hear from some of the leaders in the mental health space in Queensland. And as I said jokingly before, we do have a really high calibre set of speakers today who are leaders in this field, so really thankful for them for coming along. And firstly, as always, this time of year we have Ivan Frkovic. I think many of you already know who Ivan is, so I don't need to give a long introduction to you, Ivan, but Ivan is the Queensland Mental Health Commissioner, been in that role for many years, great supporter of Queensland Mental Health Week, and we're really delighted that you can join us here today. So please welcome Ivan.
We've got the slides?
We do.
Good. Thank you. And
Just there, and I'll go forward for you.
Okay. Thank you. Good morning, everybody. Good to see you all. I just thought I'd take you a bit of a journey around where mental health is at in Queensland at the moment, but then also finish with Mental Health Week and the importance of Mental Health Week for us in this sector. I'd also like to start by acknowledging the traditional owners of the lands that we meet on, the Turrbal Yagara people, and pay my respect to elders past, present and emerging. Look, mental health, just general sort of introductory comment before we go to, and you can go to slide 1. Mental health in Queensland, and I'm biased because I'm a Queenslander and I'm sort of in this role, is probably in a good space, to be honest with you. Now, I know there's still going to be challenges, people experiencing a whole range of challenges in service land, etc. But at the big picture level where I work, I think we're probably in the best period we've been for a long time. And I'll tell you why, and it's not all about dollars, but dollars do help. We've actually had a parliamentary inquiry here a couple of years ago, which was a great shift in driving mental health reform. We had a parliamentary inquiry, and the government then responded, and including this government, all governments, I'm not playing the red or the blue team, but governments generally have continued to support this. We've had $2 billion invested in mental health. $2 billion in addition to what we had originally. Now, I've been in this game, as you can tell by my hairstyle, for a long time. I've never seen that sort of money come into mental health, drug and alcohol, and suicide prevention. And so to me, I think it's really about how do we take advantage of that to ensure that we're driving both in terms of improving access for people, addressing some of the demand for services, but then also making sure that the quality of these services are of the highest level. Good morning. And so it's really about how do we take advantage. We've got a good, clear policy direction, I think, and we've got dollars, which is really the unusual things that you don't have. A lot of times we have great policy directions and great ambition, but we're always short on dollars. I think for the first time, at least in my life in this game, and not that we haven't had dollars before, we have, but we've got a huge investment. And we've got a clear policy direction and commitment by government where we want to go. So I think in that sense, I'm hoping that we see over the next couple of years, because we've already sort of spent the first two and a half years of that now nearly $2 billion in mental health, that we will start to see some change in terms of people's access to services, but also in terms of the quality of services that they are starting to receive. So having said that, I'll just go into some of the more breakdown information and data. We're still talking about the prevalence still being 1 in 5 in any 12 months. So the prevalence rate in Australia and in Queensland hasn't changed. But if you take that down, so that's 1 in 5 in any 1 year. But if you break that down and you look at sort of in a lifetime, it's 1 in 2 just about. Nearly 50% of people in this country will experience some sort of psychological distress. It doesn't have to be a severe, complex mental, some level of psychological distress in a broad sense in a lifetime. It'll impact on all of us in some way, in different stages of our life. So I think it's important to say why and people know this, but what it's indicating that the prevalence is not going down. The prevalence is pretty steady and has been for 20 years or so. On the other hand, it's also not going up. So I think it's sort of sitting at that, and so it's sort of, really stuck at this level that we can't, even with this new investment, clear policy directions, etc., it's not going down. And so I think that's a bit of a challenge for us all, and I'll talk more about that. The bit that we all worry about, which is linked to that, is around the rates of suicide. Now, obviously, leading cause of death for this age group, 15 to 24. But can I say, and look, when we lose people to suicide, one suicide is too many. We're not talking about numbers here, we're talking about people. But again, having said that, we lost last year, and I'm just about to release next week, we've got the release of the Queensland suicide rates report on Tuesday, Wednesday, World Suicide Prevention Day. We still lost last year, calendar year, 764, I think it is, people to suicide. We're still one of the highest in the country. We're not the highest, but we're still one of the highest in the country. The only good news and a bit of, bright light in all of this, we're the only jurisdiction where the rates aren't going north. Our rates, and I'm not a great researcher, I'm a social researcher, I've done all that sort of stuff, and I was always scared to use the concept of a trend going down, but we've had 4 years of trends going down, numbers going down, which actually indicates a trend. So 4 or 5 years ago, we had about 815 people die by suicide. Now we're on about 764 or 5, So you can see the trend going down. The problem is that we're still losing too many people, and we've still got work to do when it comes to actually suicide. So within that group, yes, this group, that's the major cause of death for this group, but our biggest group is men. 75%, in fact, in the report, which I'll talk to on Wednesday next week, which we're releasing for last year's data, it's nearly 78% of all deaths are males. So you can see that we've got a lot of work to do in that space. What can we do differently in terms of supporting men who are considering suicide as an option? I think that's something that we as a sector, as a collective, need to think about moving forward. How do we tackle suicide amongst particularly men? And I'll just finish off on that in terms of, we did some work with the coroner, and generally the notion in the community and the evidence up to now would suggest men aren't good at seeking help, reaching out for help. In fact, the work that we did with the coroner, we reviewed about, out of the 760 that happened in that year, whatever it was, 780, we looked at 155 coroner's reports on men who died by suicide. So it was quite a large sample size out of the people who died. What was interesting is the notion that men don't ask for help is not true. The reality is men do ask for help. The question is, where do they ask for help? And I can tell you, with all due respect to my clinical friends from the private or the public sector, they won't go to the public mental health service. But they will talk to people at work, they will talk to people at the local pub, at the local social club, at the local footy club, etc. This is about how do we build that sort of supporting network for men within those environments where they're more likely to reach out than just say, we'll provide you with more, with all due respect, psychiatrists or social workers or nurses who work in the public mental health system. So I think we've got some work to do there. And what I'd like to get out to everybody here today is about, think about within your own context, what you're doing about men's mental health, particularly around the rates of suicide that we have in Queensland and nationally. The expenditure is pretty large. You can see, and 20% of that is in Queensland. I don't need to go into that. So the cost of mental health is huge. That came from the National Productivity Commission report. This one's interesting. $13 billion worth of support, 13 billion, not millions, 13 billion, is provided by unpaid carers. Unpaid carers. That's a huge contribution. Imagine if we had to find those $13 billion to support people, which the carers provide now. That's a massive contribution that families and carers provide. But remember, that puts additional pressure on these people themselves in terms of having to do that. So it just gives you a sense of some of the big picture stuff, etc. if I just look at the national picture, I won't talk about this. We have a partnership with Beyond Blue. Most jurisdictions do, and they do the annual survey, and it was about 5,000 people, about 800 in Queensland, and nearly half of those people delayed seeking help. Delayed, and this is real concern that people aren't actually going out to get some sort of support, when they are very or extremely distressed. 8% delayed over a year, but some more than a decade didn't come forward to get some support. So what, and this again feeds into, we have a system that's designed to respond in crisis, because people aren't coming in early or don't have, to be fair, people don't have too many options to go and get support early. And then if you break that down, these are the major reasons: cost, and then the wait times. So I think we've got some challenges around making sure that people have got access to these services. Even, as I said, with that huge increase in Queensland, we've still got some of these challenges. This is our problem, why people are not, at least on that survey, which Beyond Blue does annually, which indicates. And this is where I think, particularly around that early support, early intervention, where particularly primary healthcare, the non-government sector, plays a huge role. And I think we've got to shift the system where investment also needs to be put into early intervention and prevention, rather than most of our investment going into the sort of more acute end of the system, or, as I normally say in a general sense, the hospital end of the system. So I think we've got to think about how do we move the system further down that end. Queensland data, there was about 800 people from Queensland in that survey. Again, the major barriers: 43 cost in Queensland, wait lists. So we had some significant differences to the national average, but you can see that's how, this is 7% of people in Queensland rated their health as really poor, their mental health as poor, health generally, but mental health, versus the national average of 4%. So Queenslanders feel that their health and mental health is actually worse. This is an interesting one, particularly for us as a geographically dispersed state. It's easy for Victorians to say regional Victoria, where you drive 2 hours and you're there. We fly 2 hours and we're still not there. That's the sort of difference. But it's quite interesting that people, they're not less likely to seek online support. And I think this is a challenge for us. People, I think we've always said, well, for regional Queensland, we'll just provide some online, support, et cetera, et cetera. Yes, that people do accept that, but we've got to also complement that with face-to-face direct support and local support, build some of that local community infrastructure and services. It can't be one or the other. I think it's a combination of both. Some of the distress factors, have a look at that. This is nothing unusual in the current climate, cost of living, financial pressures, but for us in Queensland, particularly housing stress. Not that it's not another job, but housing stress is. And in fact, as I was talking earlier about the data around the rates of suicide, for the first time in the so we get the data where the police fill out a form when they go out to a suicide. For the first time, we're starting to see in the notes housing pressure, housing stress. People were evicted, people were lost their job, couldn't pay for their rent. So housing stress has started to actually show in that data. So for us, that's a really big one, and obviously cost of living, but this one is certainly starting to surface across a whole range of areas in terms of need. And in terms of poor access to social supports, I'm sure my colleague will speak here around some of this psychosocial support, we've got higher than the national average. Our psychosocial support element is about 4.68% of the state mental health budget, which I think is nowhere near where it needs to be. Now, when I say that, I don't include the NDIS money, but what the state provides versus psychosocial support and clinical support. We've only got 4.8% here, while, for example, I was talking to some colleagues yesterday from New Zealand, in certain HHSs in New Zealand, where they're investing 25% into their non-government sector psychosocial support versus inpatient. they don't have the same pressures on EDs or inpatient beds. And quality of service and quality of life improves. So I think these are the sorts of challenges we've got in the system here in Queensland. Okay, just to give you some of that sort of larger picture stuff, the Queensland government, and we're just refreshing this because there was a change of government, really the strategic direction around where we're going with mental health, not just in health, so you've got better care in health, you've got the student wellbeing plan in education, you've got the drug and alcohol plan, for example, in Department of Corrective Services. There's a whole range of plans, but the overarching plan is shifting mind. It's a whole of government plan around mental health, and it impacts and is the responsibility for implementation to do with child safety, housing, education, health, etc. So that's what's driving some of this in terms of whole of government. So if I just can say, and I've been around the world and I've looked at different mental health systems, there's 4 critical pillars to a good mental health system. 4 critical pillars. And can I say no one's got this right anywhere that I've been? The first pillar is obviously having access to timely, quality clinical care. Second is having access to timely, quality psychosocial support. Thirdly, it's access to affordable, appropriate housing, including support. And fourthly, so the fourth leg of the stool is about having access to employment and education. Now that's a good mental health system, and you need a level of investment in those 4 areas to be able to have a good balanced stool, but also a good balanced investment in the community's mental health. There's other things, but they're the core features. We don't have it. No one interstate's got it, but I can also tell you no one around the world has got the right balance there either. We're all struggling in different areas, but that's the core of a good mental health system. Out of that $2 billion I spoke about, most of that money has gone to health. For public health services, beds and clinicians, etc. Some money has gone to the mental health non-government sector, to the AOD non-government sector, and a whole range of other programs. Some money came to us, a very small amount, to look at those things which were outside of the treatment services. So we were able to, for the first time, invest, and it's going to be about 9, maybe 12 million, not billion, sorry, I wish it was billion, $9 million with an extra $3 million into projects and programs in communities about how do you maintain well-being? How do you keep people well? So not just all about treatment, how do you actually work at the preventative, at the population level to keep people well, but also to prevent some things from actually occurring. So we've got some money for the first time. For example, this one we've worked with education, the student wellbeing measure. That's about $120 million that education put into student wellbeing. That's, again, the public sector, not the Catholics or the independents. The public sector has invested $120+ million into student wellbeing. That means there's about 464, if the number's still right from what I remember, psychologists, social workers in schools, and then there's about 50 schools with GPs placed in them. So it's quite, we're really looking at how do you actually keep students well. As we know, the problems with bullying, social media, etc. So and then we've also done some work around better futures, and there's some grants around additional knowledge and research in various areas, young people, etc., to better understand some of these issues, to be able to move forward with them. So we've been able to get some money that's not just gone into treatment services, but that's starting to shape some of these other areas. And that's the levy. That's the $2 billion comes from a levy. So it was a brave government to introduce, yes, we call it a levy, but remember, that's a tax. That's an extra tax. So they've introduced the levy to give additional money to mental health. So we've got to try and make sure that we get the best outcomes out of that. Thank you. Look, these are, I won't go through these, but these are some of the things that we have funded, some examples around that social and emotional well-being, or the sort of well-being sort of investment. But one which I think is probably the one that's not on there, is how we started to work around suicide with First Nations communities. For the first time in a long time, and not just now, but before, we were able to persuade the government to give us money to work with Indigenous communities with no strings attached. Because what happens is, in Brisbane, in George Street, or in Canberra, you will have this program in Billawheeler, you'll have this in Lockhart, you'll have this, because we know best in Canberra or in Brisbane what you need up there. Obviously it doesn't work. But what we've done here, but also with some funds we got, I think it was about 2 or 3 years ago, was persuade government to give us no strings attached. Let's go work with those communities about how they think they could tackle that. And can I say now we're working with Lockhart River, Doomadgee, Mornington Island and Cohen. And it's interesting, like we hold the data around all the suicides in Queensland. And look, and this is not to say that it won't happen, but we're not seeing suicides in those communities. They're doing things, what's best for them to be able to address those things. Rather than Ivan telling them from George Street, I think you need this program in Mornington Island. That's the difference that we're trying to get here. So I think we're trying to fund things that are outside of your normal treatment services or even some of that sort of specific psychosocial type of supports. Even though I think within that we've been quite, because I think we think psychosocial support, I've got to have a worker who comes out and speaks to me. But we've got things like we fund the Upbeat Arts Choir, which is a fantastic way to provide psychosocial support. We've got to be more creative about how we do that. Okay. And this is where I think primary health care, we've got to do some more work around, again, the whole challenge with, the MBS system and GPs and claiming and what they can do and 5-minute, appointments and all that. These things don't help in terms of, primary health care can really play an important role. And this is one that we're doing some work on a much more statewide sort of campaign level. But stigma is a big issue still in the community. Now, if you look at the data, and Beyond Blue's got actually some of this data, when you think about the high prevalence disorders, so your depression, anxiety, high prevalence, the level of stigma discrimination is down compared to what it was, say, 10 years ago. But when you talk about schizophrenia, bipolar, etc., not in my backyard. That's the sort of difference we've still got. So we've still got a lot of work to do. And can I tell you that the stigma and discrimination is probably even higher for people that have drug and alcohol problems and their families. And it's quite interesting how, I've worked in this space for a long time, but the level of stigma experienced by both families and people who have an addiction is much greater than even mental health. Because remember, it's not illegal to have a mental illness, but it is illegal to use substances, apart from alcohol, because we think that's good. These are the sorts of things, these are the sorts of challenges that we've got in society, but the level of stigma felt by people who have basically drug and alcohol problems is huge. Again, we've got to try and move the system up here. As I said, out of that $2 billion, most of it has gone on to treatment type services. Very little has gone up here. Very little. We've got to, if we move forward, and I hope we will, that in future budgets and things, we will see disproportionately more investment here than we're seeing in the treatment system. The reality is we're never going to have enough beds and doctors and nurses if we just continue to invest there. How do we keep people well? How do we prevent certain, but how do we intervene early in other contexts? Increase our literacy, understanding of the importance of, staying well, looking after your mental health, exercise, diet, a whole range of things. And this whole concept around Mental Health Week, connection, social connection. I think, and this is probably a gross generalisation, because I come from a fairly strong cultural background, I feel that in the larger cities here, we're losing that social community fabric. The only place that I feel it and I see it is when I go to regional Queensland. There are still elements of that. People don't know who their neighbour is. People don't even care who their neighbour is. Or if their neighbour is doing well or not doing well. Have they got food on the table tonight? They're the concepts we've lost the sense of community and connection. And I think it's really a shame that we've got to go back and now, from a government perspective, intentionally invest in rebuilding connection. Intentionally invest in rebuilding connection. But that's a critical one in terms of community mental health overall. Social connection, if you look at the sort of recent research around loneliness, it's huge. And it's not just, we think generally loneliness, older Australians. It's not the case. It's across the board, including young people. Just because you've got an iPhone and you've got 40,000 people following you doesn't mean that you're not socially isolated. And they're the sorts of challenges we've got in society that I think we've got to do better. And Mental Health Week, I'll finish off with this. It's happening again. We've got a whole range of things that are occurring. We at the Commission support Checkup, but we also support the whole community in really raising awareness around. And this year the focus is on connection. Make a connection. And so there's a range of activities which have been funded. Last year I think there was over 500 that registered with this process. I'm sure there was more, and it's probably the largest that we've had.
Yeah, it was 553.
There you go, he remembers the number exactly. So there was quite a lot of activity, but we've got our 4 signature events. We've got the Walk for Awareness, we've got the art exhibition at City Hall, we have the Mental Health Week Awards, which are really critical. And then we've also got Out of the Mist, which is a sort of a movie film exhibition. It's both national and international. So there are 4 signature ones that we fund, in addition to a whole range of different small grants that different people got across the state. What I would like to encourage you is, within your spheres of influence and people online, think about organising activities and engagement, and activities that will connect people, during Mental Health Week. But don't just make it during Mental Health Week, as I say every year, make it every week. Let's start to build that connected lives, connected communities. That's probably all I really wanted to touch on. I hope that was useful. Just gives you a bit of a big picture sort of stuff that we're working with. And again, hopefully it's a good Mental Health Week again, lots of activities, but also ultimately it's also about how do we improve the mental health and wellbeing of our Queenslanders. Thank you.
Ivan, lots to think about there, and excellent plug there for Mental Health Week. You've really covered a lot of the things I was going to cover, but people online, if you don't know about Mental Health Week and how you can get involved, please visit the website, and lots of information there. I think we're going to hit 600 this year, Ivan. I'm positive that we'll get there. All right, so Ivan, you were able to stay for a little while? Stay for a little while. Yeah. Were there any questions? Just if anyone had a burning question? No? I think you covered everything nicely there. So thanks once again.
Can I just ask one question?
Yeah.
Hello. I was just wondering, with the change to the way that you funded services in North Queensland, particularly Aboriginal and Torres Strait Islander, not services, more funding communities around mental health, what's the sort of time frame that it's taken to make a difference? You're talking about changes in rates of suicidality and those sorts of things. So has it been years? Is it what?
Look, with some communities, depending on where they were at, is probably again, I'm trying to say the data is not conclusive as we know, but the early indications are that as a result of the work that's happening, we're not seeing the numbers. Remember, these are small communities. They previously had not huge numbers, but obviously proportionally, that's a lot for that community. But it's really about, we're starting to see the early signs that if you do some of this work locally and within the community, and the community takes ownership of this, that you're more likely to actually achieve these out. The early signs are good. We're seeing the signs because we just look at the data at the back end, because we collect all the data. The police give us all the forms which come through the coroner. And then we look at those locations. And we can see that, say, for example, in the last 12 months, there's been no suicide, for example. And in fact, just if I can add around the data, what we're doing more with the data now, which is probably even, I think, better. So we're talking to main roads and transport, saying, for example, this bridge or that train station has had a number of suicides. This bridge, I don't like using the word, is a hotspot, but it's a place where people tend to go. And what's been interesting, we've been able to have the discussion around, because if you look at the evidence, preventing access to means is a massive suicide prevention impact. So for example, if a lot of you probably walk across the Story Bridge or ride or drive, you'll see the fence that was put up there. We used to have suicides on that particular bridge. Guess what? We don't have anymore. So we're working with Main Roads and Transport, for example, about not just the existing bridges. So we use the data to say there was, 5, 6 people who died by suicide at this particular location, this bridge, or this train station, for example. And then we work with them about what can we do to reduce the access to means. The other one is with parks, roads, and others. For example, there are certain locations in parks and walking tracks and cliffs and things where people also, so we've been able to work with them. How do you put barriers? How do you do this? Or, put a phone line that someone can ring in that last minute. So we're using the data differently, but we're at the back end looking at where things are happening so we can actually make some interventions. Thank you. Yes. Hello.
I think you just brought up a big thing that has been a big change in how we approach health and healthcare is, for example, when the AIDS epidemic came out, we started to develop the multidisciplinary approach, and we also involved the people who were lived experience from QAC. And then COVID came in and we did the same thing. So now we're looking at, like there's an old saying, if a flower doesn't bloom, fix the environment, not the flower. And so we're looking at all those, so we engagement with all those sectors is really important. You spoke about education, you spoke about economics, you spoke about all that. So yeah, I just thought I'd,
I think you're
a big movement.
I think 2 points out of what you just said. The social determinants of mental health or health are critical. We're not going to resolve the mental health issues in Australia or Queensland or internationally just by focusing on health. The social determinants, housing, education, employment, economic status, all those things are really critical in terms of addressing mental health. And the second point around lived experience, and I didn't probably touch on that. Look, we in Queensland, again, I'm biased, I'm a Queenslander, but we've probably done better than most other jurisdictions. We've got over 250, 60, I think, lived experience workers in the public system. The non-government sector, I don't even know how many. I think it's probably double that, if not more. Like, lived experience is not just at the front line providing peer work, but we've developed organisations and advocacy groups, and people are at the leadership level. Because ultimately, everything that we do, all that stuff that we do, is about the people. And the best input you're going to get into policy, into funding decisions, into clinical practice, into service management, is going to be by people with lived experience who are experiencing that every day. So again, in Queensland, we've done quite a lot in that space, including with our colleagues at the Alliance, with scholarships, getting more people educated. A whole range of things are happening around making sure that our multidisciplinary teams aren't focused on what I always call the famous 5, which used to be psychiatry, nursing, social work, OT, and psychology. That's what we've built the system on. I think there's many more professions, including lived experience and paraprofessionals, who could contribute to the mental health of our society.
Thanks, Ivan. All right, well, we'll keep moving along, and just while Emily's getting set up there, I'd just like to mention that today's session is sponsored, and I'd like to acknowledge Carole Cooper from Carole Cooper Consulting. We'll hear from Carole towards the end of the meeting, but just wanted to give my thanks, Carole. We've got the technology working, we've got people in the room, and these sort of events wouldn't be possible without some funding. So thank you so much. Okay, next speaker is Emily Walter. She's the CEO of the Queensland Alliance for Mental Health. Emily is passionate about amplifying lived experience, modernising communication systems, and pushing for systemic reforms that focus on people rather than processes. So please join me in welcoming Emily.
Oh, perfect. I was going to say I have a few more slides than Ivan, so we might need to tango if you're driving for me, so that's great. Thank you very much, and thank you for welcoming me. I might try to keep mine a little bit shorter so that we can run a little bit closer to on time today. Thank you so much for having me this morning. I am Emily. I'm the CEO of the Queensland Alliance for Mental Health. And before I get started, I would also like to acknowledge the traditional custodians of the lands on which we meet today, the Yagara and Turrbal people here on Meanjin. What a beautiful time to be in Brisbane too, isn't it? With River Fire and with the Brisbane Festival going on. It is really an honor to be here on Meanjin lands. Now, it looks like I'm going to be talking for about 55 minutes, the way that this presentation, oh, there we go, is set out with the agenda, but really with everything that Ivan was able to cover today, I did want to just focus a little bit more on the Queensland Alliance for Mental Health and what we call the community-based mental health sector is really focused on. I know we have some providers in the room today, which is very exciting, and Ivan was able to give a really great rundown of Queensland's mental health and the mental health system. And I suppose before I get started, I would just really like to point out that I'm very proud that we can talk about mental health and well-being rather than things like suicide, because here in Queensland we know that the suicide stats are outstanding. Over 700 is far too many. But at the Alliance, we're able to work with our providers to talk about what well-being really means and what place-based mental health service providers can do, which is something that I will cover in a moment. So a little bit about the Alliance, and sometimes when I say we're a peak body, people think I say P-body, so I've really gotten good at enunciating the K at the end, a peak body. Sometimes people go, what does a peak body do precisely? We are an advocacy body, and we run with under 15 people. They've adopted this small but mighty team, is what I always say about our team. I think we're about 12 people, and I would say with all the output that we do provide, sometimes I think that there's an assumption that we're a bigger team. But we do focus on advocacy, and that advocacy is for our member organizations. So whereas some peak bodies might talk about the consumer, so the people utilizing the mental health services, or the carers and families, so those supporting people who are requiring mental health support, we actually support member organizations, so the service providers who typically come to us because they want the system to work better, they want some advocacy, usually for funding, so that they can stand up their services and so that they can increase the workforce who are providing those really vital support services to patients or clients or members, however it is that they call the people who use their services. So we do support the metro, regional, and rural communities, and that's something that we're really focusing more on, as Ivan so rightly stated. Queensland is just so huge. And so a big focus for QAMH at the moment is really reaching those rural and regional areas where we know mental health stats are disproportionately worse than other areas as well. So really driving reform. My team's so creative. Sometimes I see what they put together and I'm like, it's very strong. Driving reform and promoting and strengthening the sector is really what we're focused on. Now, I'm not going to cover too much of what's going on here in Queensland, but I do think it's important because when we say psychosocial supports, I think even across our sector, people are confused with what it is that means. So if you'll just bear with me while I explain to you what community mental health really means, because so many times we think mental health means you're in a clinic or sometimes in the hospital getting that support service that you need. But community mental health is all about keeping people outside of hospitals and clinics. So that's really what we focus on. It's for people who are not eligible for NDIS, and we know how, if you've heard much about NDIS, I think we just associate NDIS with a bit of a mess and a lot of shortage for people who really do need support. So community mental health is really important for those who do need NDIS support services but may or may not be able to reach them. Those facing barriers to accessing mainstream mental health services, so the ones that I just mentioned, and people whose needs are really critical and significant. And so I think sometimes we think preventative or maybe nice to have, but community mental health actually provides support for people with complex and severe mental health needs as well. Many of our providers are either have clinics or they partner with the clinical sector as well. So it's really about holistic support. It's not one or another, but it's, as I say, the goal is to keep people in the community and before they hit crisis. So a big part, as I mentioned, of what we do is advocate for additional funding. So you just heard Ivan before talk about the really limited funding that our sector receives. It's around 4 to 5% of the overall Queensland state budget. And so something that we do, and we're always tapping on Ivan's door, and I will say Ivan's very supportive of community mental health, but a big role that we play is in advocating for additional funding for our support services. One thing that I did want to note is that within the state budget, they funded 2 step-up, step-down youth facilities. So these are what you don't think of, I think, when you think of mental health support services. So these are short-term residential services, and they offer individualized care in a community-based setting. Ivan was able to touch on some of the reports across the state, so I won't get into that. I'll scoot right past that, but talking about psychosocial supports. So these are non-clinical, community-based services designed to facilitate recovery for people experiencing mental health challenges. So this is all about helping individuals manage their daily lives, stay in schools, stay in their education, stay in employment, and stay with their families and communities. So this is especially vital for people with severe mental health challenges, and it supports essential daily functioning and reduces reliance on those acute health services. We know how big of an issue hospital admissions or hospital overflow and ambulance ramping is here in Queensland, and something that we do is try to keep, again, mental health out of hospitals and out of hospital beds. So you'll hear us talk about something that we call the PATHS project and the PATHS program, and this is a program that was piloted throughout Townsville, and it's a scalable program that offers support services across communities in a place-based way. So when we say place-based, it's what Ivan was talking about before, where the communities know what's best for their community, so they offer more culturally appropriate services to those in community. And you might see through some of QAMH's advocacy, we talk about this program because it's a scalable program, and by piloting this in Townsville, we were able to identify some of the gaps and key initiatives for scalability. So just talking about a little bit of what QMH has really focused on. So I will touch on this in a minute, but we usually do about 15 to 20 advocacy submissions every year. It just really depends on what new ideas the government comes up with or what kind of crosses our desk as far as new initiatives or anything that touches on the reform scale. That's something that we like to test with our members, what's important for us to speak on. So one thing that we did very recently was around the National Mental Health and Suicide Prevention Agreement. So they had an interim review here. So QAMH, we really urged a shift in investment towards the community-based setting. And as again, as Ivan was talking about, with the mental health levy, it's really important to know that we talk about not just getting more funding, but how can we use that funding for better, especially for community health. So we're always highlighting systemic flaws, fragmented governance, insufficient funding, and lived experience contributions as well, and the importance of recognizing lived experience comes with experience and not necessarily similar qualifications as what you might find in other sectors or other areas of work. So we were also at the public hearing just a few weeks ago, just talking about the National Mental Health and Suicide Prevention Agreement. With the Queensland budget, what you need to know here is there's basically, I wouldn't say an argument, but there's probably lack of agreement on who's paying for what when it comes to these psychosocial supports that I'm talking about. So together with the other state peak bodies, because there's a peak body in every state, and then there's national peak bodies as well. So we called for a 50-50 funding partnership between Commonwealth and state, so we can reach some agreement on who's paying for these supports that community does need. The national peak bodies you might know of are Mental Health Australia and Community Mental Health Australia. So those are the ones that we were closest with. I've already touched on psychosocial support. So again, outside of the NDIS, there's over 92,000 Queenslanders who are missing out on the support they need. And over, I think it's now 500,000 nationwide who also need additional psychosocial supports that they are not funded to provide, or services aren't funded to provide. Now, we talk a lot about workforce, and we also have a workforce strategy, which is in implementation at the moment, and I'll touch on that in a little bit. But a lot of our work is around not just retaining the workforce, but how are we increasing the workforce and getting the right people in the job. So we have a huge focus on First Nations and multicultural workforce streams, and that's something, again, I will touch on in just a moment. So what do I have here? I've touched on probably most of that, so I might skip by that part. Now, something that we're really focused on at the moment is evidencing the quality and the impact of our sector. Many of you in the room are probably quite well aware that data and evaluation just varies depending on which sector you're working within, and the sectors don't talk to each other very well. And I mean, even between clinical and community-based settings, they have very different ways of evaluating and measuring what we call outcomes. And I like to always point out that in community mental health versus, let's say, a clinical setting, sometimes a more successful service provider is actually one that retains clients or the community, because their program is actually all based on keeping people within their community. And so to measure it is quite a nuanced process, but that's something that QAMH is working really hard on with our member orgs. It's a conversation that I think Ivan and I have had, but we will continue to have as well. Now, let's see if I had anything specific here. Again, We continue to advocate for funding around psychosocial supports, so programs that improve well-being, resilience, and emotional regulation. We focus a lot on what Ivan mentioned before, which is determinants of health as well. But what I really wanted to point out was on the bottom of the screen under number 5, so return on investment, because government, especially this government, is going to be really concerned with what does my dollar get me. So in community mental health, we found that there's anywhere from $3 to $5 for every $1. So that's the ROI on the investment in community mental health. So for every $1, you get up to $5 ROI. It's kind of hard to talk about money when it comes to mental health, but it is also important to know that the dollar really does count in community. And when it's under 5% of the Queensland state budget, it's just really important to point out you are getting your money's worth when you fund community mental health providers. Again, I have touched on this just briefly, but we are working on gathering evaluation data from members. And we've just recently published a policy briefing which showcases some of the outcomes. And of course, something that we need to focus on here is not just the quantitative data, but qualitative and some case studies around our members as well. So we're just now starting to collate, well, what are people actually saying? What are people who are using these services saying? So you can see some of those quotes here on the board. QAMH is going through a huge kind of a branding refresh, or just some messaging around what our members are really getting out of, not just QAMH, but what their clients or service users are getting out of the services that they do provide as well. Where to from here? So we talked a little bit about connection just before, but prevention and well-being. So working ahead, you've heard me talk about Paths Project as well, so you can expect to see more of us talking about, well, actually there is a solution that's already ready to go and it's scalable, and we've tested it in Townsville, and we have some wonderful ideas around how to bring that out into different communities as well. QAMH currently has a new strategic plan, which is just about to be ticked off, so that one will be for the next 5 years. But something that we are doing, which is a little bit different, I think, from most peak bodies, is heavily focusing on innovation. And I think very relevant right now is the utilization of AI across our service providers and also with ourselves. How can we utilize AI not to further disconnect people, but to actually keep people together and connected? So we already do have some services who are using AI, especially for rural and remote areas and populations. But we're talking about the utilization of AI for training peer workers and focusing on multicultural workforces as well. I mentioned before that we're in the second year of implementation of our workforce strategy, so the Queensland Community Mental Health Workforce Strategy. And again, we now have a First Nations Workforce Project Officer who's focused on First Nations communities. And then we have a multicultural officer as well who's focused on how do we get the right people in the right spaces in their communities. We're growing our membership body at the moment, so we are a member-based org, but we keep membership fees very minimal, and the point of that is that we're stronger together when we can advocate together. So in order for us to really go to Ivan or go to government with a really strong pitch and strong positioning, the more members and the more variety of voices that we have, the better. We continue to center our members and those using services and share our work and advocacy just with the support of our members and those utilizing the services. I love this cheesy photo of myself, there we go. But QAMH is always very open to discussion and chatting about not just membership, but also how can you become involved, whether you're a member or someone who's working with a research body or looking for partnership across the community mental health space. How can we work with you to amplify your voice and your needs across the sector? So this is Chloe Jessen, if you haven't met her before. She's the Deputy CEO, and she tends to do a lot of our member engagement. But yeah, you're always welcome to reach out as well. Thank you very, very much for having me. I appreciate it.
Thanks, everyone.
Thank you.
Thanks so much. Are there any questions? We've probably got time just for one. No? Okay, well, we'll keep moving. Our next speaker is James Hill. James he'll share his lived experience of mental ill health and recovery. Lived experience voices like James's remind us of a simple truth. Mental ill health can touch anyone. James, thank you for being here and for sharing your story today. Over to you.
All right, thank you. Thanks for having me along. It was interesting to hear from both Emily and Ivan around the engagement of lived experience. But what I do want to talk about first is real sort of engagement with that lived experience, because when advocates like me share any part of our story or our personal stuff, it gets me emotional because it's real. That's my life we're talking about. So it's not tokenistic that you can just bring a lived experience person in and not value what they bring to the table. You need to understand the toll and the emotional impacts that takes on that person. So I feel grateful that I'm here today to be able to share some of my insights and my journey, and I can only speak from my own perspective because I don't speak for everybody with a lived experience. There may be similarities within our journeys, but my journey is my journey. The stigma side of things is probably the big thing that sort of held me back. I've lived with a mental illness my whole life. However, I didn't know that most of my life. Not being able to talk about these things and the demographic that Ivan's talking about, that I fit in, being a male, I've worked in heavily male-dominated organisations and cultures for all of my life, surrounded by other men who don't talk about this topic, is one of the things that held me back. The 1 in 5, I've been that 1 in 5 without recognising it. It doesn't happen to people like me. People like me don't experience mental ill health, is what I thought. So I'd turn up to work, with bumps, bruises, and all sorts of stuff, and just hold myself together with bits of insulation tape. I'm from the construction trade. I'm from the Sparky is my background. I work in the electricity industry. We wouldn't go to the doctor for anything physical. There's no way in the world we'd be going there for anything emotional. I didn't see emotions on the sites and the people I engaged with. The only emotions I ever saw were anger and humour. And that's how we tend to hide these things that we don't understand and we don't know what to do with, is I'll joke it off, or I don't know what to do. So that you get that frustration, the emotion that comes out, and it's usually anger or frustration, those types of things. I lived with that for a long time, and I masked it in many, many ways. The one thing to realise is that these things, that there may be similarities, there may be things that we experience, and we all go through challenges in life. We all may have poor mental health at times, and that early intervention is the key to address that, because if we prolong that and we live with this distress for a long time, it can become more significant, more severe, and particularly if you're predispositioned to a mental health condition, as was I. Now, I didn't just wake up one morning and I was really in a bad spot. It gradually got worse over time. There was a lot of signs and symptoms I didn't understand, so I masked them. I've got a wife, 2 kids. I hid it from them. I'm the provider for my family. I've got to be the strong one. I fix everything. I can't never be broken. That was my mindset. There was a shame and a fear that came with going through a challenging time and tough times that I didn't know who to reach out to. And because I didn't understand it, because we didn't talk about it, I couldn't go into work and say, hey boys, I feel like a hug because I'm having a tough time. That's not going to happen. So where do I go? I don't want to tell my wife because I don't want to let her down. Where do I go? Obviously, we've got the extreme end where we can go to our medical sort of emergency departments. And what can we do before that? Because for me, it had to get to that critical point, unfortunately, where my life was almost ended. And subconsciously, prior to that, I knew that something was going wrong. I was telling myself, you're having some kind of breakdown or something, and I'm like, it doesn't happen to people like me. The only way that I could see through was to not be here anymore. Thankfully, for me, Beyond Blue saved my life. Sometimes things happen in life and we can't explain it, why, and it's only in hindsight when you look back you can join the dots and see why that was. And at the critical time, I reached for my phone. Maybe I was going to send a goodbye message, I'm not sure, but an advert came up for Beyond Blue. and it was a man therapy. Like, take the test for depression and anxiety. No idea to this day why that came up on my phone at that particular moment in time, but I'm so glad it did, because it changed the whole trajectory of my life and for a lot of other people that I've supported and helped since. But I didn't just see that advert and go, oh, beauty, that's what's going on. But for some reason, subconsciously, my mind said, take this test, answer these questions, just to rule that out, because that's not you. You don't live with those conditions and things like that, because that's other people. So I did. I answered the questions honestly. And it said, there was enough signs and symptoms there that I may be living with some serious sort of issues, and they gave me an insight into some of those signs and symptoms on the website, and I started reading, and I went, you know what, that does seem like some of the things I've been experiencing. It was enough to put the brakes on at that moment in time, though. Going and getting support is the next hardest step. For me, the first thing was realizing and understanding myself that, hey, maybe I am that 1 in 5 at the moment. And that wasn't easy. So I sat on that for quite a few days, probably a week or two, not knowing what to do. I still didn't tell anybody because of that shame and that fear and that stigma, and I didn't know where to go. And I thought, well, do I go to my GP? What do I say? I look fine, nothing wrong with me. But I did have the courage to go to that doctor's appointment. I went in there, and again, just sitting in there, I didn't have the energy to actually get up and walk out of there. I wanted to, but I was just that broken. But I felt I didn't deserve to be there. I was looking around, and there was people with real, genuine things, people with bandages and cuts and bruises, and kids running around with snotty noses, and I'm like, I'm wasting the doctor's time. But I didn't have the energy to go out. Thankfully, I went through that appointment and sort of started to get some support and the help I needed. This wasn't a 5-minute journey, and I live with this still to this day. I'm going back now 10, 15 years ago. I still live with my challenges, but the one thing I did notice was, what can I do from this now? And as I say, it changed the whole trajectory of my life, because I was working in the electricity industry in the supply distribution network for Queensland. And I realized that I couldn't talk about that at work. That needs to change. Thankfully, I was supported by my business after a little while of trying to convince, but created a role where we've grown over the last 8 years in that looks after mental health, dedicated. I had a mental health advocate role. I started working for Beyond Blue as a speaker because I needed to see people just like me sharing their story. And that's where that advocacy comes in. To me, like I say, it's not tokenistic. So I don't just go, hey, I'm going to share my story here, there, and everywhere, because it's deeply emotional to me. And to get that out and put it out there, I need to know that there's going to be something that's worthwhile that comes off the back of that. So I've been working for Beyond Blue for a long time. I've worked with the Commission on quite a few different projects in the suicide prevention space, in the mental ill health space. But the thing that I really want to share today is with everybody is around the topic of what we're looking at in Mental Health Week, is that connection. And that connection for self first. I thought I was connected to myself. I was recognizing that something wasn't right, but I wasn't deeply connected with myself. I wasn't taking that time to stop and go, you know what? Something really isn't right. Where can I go? What can I do? The next steps are connecting with that community, because I've had to go to the extreme end, to the mental health services and engage in there. That shouldn't be the first step we take, though. If we can intervene early, and those community sort of projects and things like that, that's fantastic. That's how we connect in the community, early intervention. We can hopefully prevent people getting to that crisis point if we have that in the community. Connecting with others. I found I isolated myself a lot. I didn't want to bring people down. Like, I was putting a mask on and a face, and always being the jokey guy and the happy guy, but I thought people are going to see through this. So if I withdraw and I disconnect myself from people, that'd be better. And that's probably the worst thing I could have done. But to me, it made sense. And I didn't know who I could connect with. having that ability to know who you can connect with, who can understand. How do we educate ourselves on this topic so we can check in on a mate? Like Ivan said, do you know your neighbours, the people around you, the people you work with? Do you just see them in the morning, hey, how you going? You don't really care how they're going, you just say it. It's a throwaway statement. How often do we actually go, you know what, I've noticed you don't look yourself. Is everything all right? Sit down, be part of that. And then connecting with nature. For me, I'm fortunate enough to live on the Sunshine Coast, so the beach is my connection point, but just getting outside in nature, you know, there's so many benefits to that, just taking that downtime. Today, the world is a very busy place. You know, we're rushing from here, rushing from there. We don't actually take the time to smell the roses, as it is, sort of thing, but let's do that. Let's start doing that. So it's a good opportunity to sort of focus in on these things for Mental Health Week, but not just for Mental Health Week. Every day. So I probably want to end up there to keep us on track with time, but I really thank everybody for listening and taking the time. And as I say, check in on your mates, check in on yourself, and engage when it comes to Mental Health Week. Thanks, everybody.
Much, James, and we're really fortunate to have James on our Queensland Mental Health Week working group. I think you've been on for the last 3 or 4 years now, and you know, it makes a great contribution, helps us come up with these ideas. It's not just Checkup organising Queensland Mental Health Week. We have a real cross-sector involvement, and the consumer representation is very important as well. So that's a great segue into Mental Health Week there, James. So thanks for that. I'm going to just talk a little bit about Queensland Mental Health Week. As I said earlier, it's 1 month to the day, 4th of October it begins. And Checkup's been coordinating, this is actually our 8th year coordinating Queensland Mental Health Week, hard to believe. I remember when I was around 8 years ago, we thought, how are we going to do this? There were about just under 200 events in Queensland, I remember. We thought, how are we going to get 200 events? Bye, Ivan. Everyone say bye, Ivan. Thanks, Ivan. No, we can't have that. Yeah, so I remember the first meeting, we thought, how are we going to do this? And we really focused on communities, getting small communities involved, schools involved, Aboriginal and Torres Strait Islander communities. We really took a bit of a different approach, and it has grown from around 200 events 8 years ago to, as I said earlier, 553 events last year all around Queensland. So the objectives of Queensland Mental Health Week is to raise awareness of mental health and wellbeing, encourage proactive steps to support good mental health, reduce the stigma, we've heard a lot about that this morning, promote help seeking and support services, and also to celebrate community-led initiatives. And it is a bit of a celebration. I guess it's, you know, for people who work in the industry, it's time to reflect, look at all that has been achieved, but also look ahead to what more can be done. James covered those 4 areas better than I could, so we'll skip there. So there are our sub-themes of connecting with self, community, others and nature. And really, the people online and the people in the room, we'd encourage you to get involved. There's a month to go. Our next month is going to be super busy because I think to date we only have about 60 events registered. They come in a rush and we have to moderate every event, so get them in as soon as possible. If you're thinking about a workplace event, it might be a morning tea where everyone, you know, gets together. It might be a walk to the local park, something you can do. Doesn't cost a lot of money. And we have a free event starter kit on the website, so you can go there, have a look, gives you ideas. If you don't have the capacity to host an event, you can participate in a local event, and there's lots, and we're about to hear from some of them in a moment. But there's walks, expos, workshops, yoga, sausage sizzles, all sorts of things. Surprisingly, the amount of yoga that happens during our Mental Health Week. We get a lot of applications. I should mention we also manage the grant program that I think Ivan mentioned. It's $150,000 per year, and we awarded 154 grants. from Cowan up on the Cape, Mount Isa, and all around the state. We've got really good representation. So there's 154 more events that will be registered. So Liza, you'll be busy. Liza's working on Mental Health Week. David as well. So yeah, we're expecting lots of events to come through in the next month. But as I said, yeah, we've got a lot of social media tiles, things like that you can use. We gave everyone a green ribbon in the room today, but you can buy those. Just check the website. And we also have a merchandise shop. We've got t-shirts, tea towels, and some other merch that you can buy. We've tried to keep the prices low. But if you do want to register an event, go to the website. It takes about 5 minutes to register your event. Ivan mentioned we had 550, but we reckon there's a lot more that go unregistered. A lot of people just hold events and they forget to go on the website and register it. So please make your event count. Please jump online and register it. You can mark it public or private. If it's a private event just for your workplace, it still gets up there, but we don't put out the address and other details. Yeah, so you get your own web page on the Mental Health Week website, and that's the address there. So, as I said, Ivan actually also mentioned there's 4 major events in Queensland Mental Health Week. We're hearing from 3 of those organisations that organise these events. And I'd get all 3 of our event organisers to come out the front now. David's going to just mic you up. Just while they're making their way, I'll introduce. We have Karen Hale-Robertson, who's the acting CEO of Open Minds. We have next to her Tia Delalic from RFQ, Richmond Fellowship Queensland. And we have Tudor Vasile.
Great job.
That's good. Vasil, I wasn't sure about that.
Tuna, right? Everyone goes tuna or tuna fish or
And Tudor's going to talk about the Walk for Awareness, particularly today. So please welcome our 3 panellists today. So we'll start with Karen, and you can see Karen's major event there are the Mental Health Awards. I think there's a name change this year from Mental Health Week Awards just to Mental Health Awards. Karen, could you tell us a little bit about Open Minds and then talk about the awards?
Yes, so I'll just preface with I'm the Acting Chief Executive of Open Minds at the minute. So Open Minds has a long history. We've been around for about 112 years, so a very long time. Originally started as the Queensland Wattle League, helping soldiers returning from World War I. We've evolved into what Emily was describing as a community mental health provider. So we have a mixed workforce, mainly clinical, but also psychosocial support workers, and really importantly, those people with lived and living experience, so our peer workforce. We work very hard to ensure that we co-design services with local communities to ensure that they are a space where people actually want to come to ask for help and get the assistance that they need to hopefully be back on track for recovery. So some of the services you might be familiar with, headspaces are a nice example of that. So we have about 3 of those in North Brisbane. Medicare Mental Health Centres, we currently lead 5 of those throughout New South Wales and Queensland. The newest one being on the Gold Coast, just on that one. So we're going through a phased co-design. And also sort of suicide step-up, step-down programs. So really focusing on people's intervention, recovery therapies to make sure that people, are being helped to recover from any suicidality. And also in Queensland, we're registered Australia-wide, but in Queensland we provide NDIS services, particularly community access and also independent living supports.
Sorry,
When you're ready, Dave.
I just had a message from someone. Sorry, Karen, someone like you to stop talking after such a short period. How about the Mental Health Awards? Do you want to touch on those now?
Yes. So Open Minds has been hosting the Mental Health Awards since 1996, so a long time now. And they really were introduced to, like a lot of what we've heard today, really reduce stigma, to create awareness and to, I guess, celebrate the success of the mental health sector and all of the great work that is happening. So we receive nominations from both individuals but also from organisations, including schools, workplaces, the broader community. So what is it that they are doing to actually, I guess, provide responses to people who are living, may or may not even realise, living with mental ill health challenges, and to provide responses either at that prevention, promotion end, or at the pointier end of the spectrum, which is more the intervention, hopefully early intervention. Open Minds really does focus very much on that moderate to severe, but there's lots of great work happening there throughout the community that is at that early intervention end as well. So they're really about, recognising and honouring those people and the great work that they're doing. So this year there's 10 categories, and these have been refined over time, but we have our schools category, which is both primary and secondary, and we have our early years award, Jeff Cheverton Individual Award. So for those of us lucky enough to have known Jeff, he was a real trailblazer, CEO of the Queensland Alliance for Mental Health for a long time, and we lost him quite a few years ago now. But we recognise him every year with an individual award for a great contributor to the mental health space. We've got the Lived Experience Excellence Award, a fairly, a sort of newer category, but again, usually highly competitive with the increased focus on lived and living experience. Our LGBTQIA+ Award, our Aboriginal and Torres Strait Islander peoples, and also our culturally and linguistically diverse categories. Our Not-for-Profit Organisation Award, which I think we might have to next year break down into the very small and the larger, just because it's hard for the smaller organisations to compete with some of the resources that the bigger ones have. The Workplace Awards are broken into two different focus areas, so one being community wellbeing and the other one being employee wellbeing. And then that all culminates into kind of the large award for the Earl Juice Overarching Award is what we call it, and that basically recognises an individual and the great contribution they're making to the sector and provides them with $4,000 to continue their great work. I believe Earl Juice is someone who is recognised for having lived with significant and overwhelming depression for basically their entire adult years, and left a bequest to go on to recognise individuals who are contributing to the sector. We had our highest ever number of entrants. I had a meeting before I came here this morning with our marketing team. Overwhelmed. We have 7 judges from throughout the sector who have been reviewing those tirelessly. And so a really high number, but also the highest sort of points and scoring awarded this year as well. So it's a real testament to the great work that I think is happening throughout the mental health sector in Queensland. We will have a breakfast on the 10th of October. This year we're taking it to City Hall because we are getting bigger and bigger each year. And we have the fabulous Jenny Winter, who is a comedian and an MC, but also a fearless advocate in the space of mental health. I hear that she's extremely funny. I'm looking forward to meeting her soon before we have the brekkie. And there are still tickets available, so please, if you aren't having an interesting breakfast elsewhere on the 10th, I would really encourage you to come along and to celebrate Mental Health Week and the contributions that these individuals and organisations are making. I should just say that they're not possible without the support of the financial support and sponsorship that we receive. So Ivan, who has just left us, has been providing funding for quite some time, so I will recognise the Commission. Checkup is another sponsor of one of the categories, as is the Alliance for Mental Health, the Richmond Fellowship of Queensland, Headspace National, Royal Australian and New Zealand College of Psychiatrists, the Queensland Government. So that's a little bit about the awards.
Thanks, Karen. I'll be there for the breakfast, so looking
Excellent.
forward to it.
Very good.
Great, always a great day. And there's the photo of all the winners there from last year. Okay, thanks so much, Carole. Let's move on to our next major event, and it's the Walk for Awareness. Tudor, over to you.
Big shoes to fill there, Karen. So well done. My name's Tudor from the Mental Awareness Foundation. So we are a grassroots charity. It started over 15 years ago here in Brisbane. We started back in the day when there was nothing really happening in Brisbane. So we were the first movers, we believe, in the whole community engagement piece in connecting mental health and the community together. We started with a walk called Walk. It was just a walk at the time because we lost our two best mates to suicide in a 3-month window. So we got a bunch of family and friends. Funny enough, one of our friends, Raywin, was there on the day and came down. Now she's our CEO, which is over there in the back of the room. So it was quite interesting to see that. But look, we got about 110 people down, raised $14,000. We walked in with a big envelope full of cash and gave it to Mates of Construction and Grow. And we've got that. Yeah. You can get away with it 15 years ago, but it's a bit different now. So, yeah, look, for us, that event has grown and grown. You know, pre-COVID, we got to about 3,000 people down there. We're walking 9Ks to raise awareness for the 9 Aussies. You'll see the legend James down there with a vest on, with Darius Boyd walking the walk as well and leading up the front of the pack, which is fantastic. Look, a couple of great things that come out of this event. I do say this, it's not our event. This is Queensland's event. We open this up to everybody, and Raymond's going to be kicking me now, but you know, we actually invite all charities to come down there and be involved on the day. So you'll see probably about 6 or 7 other mental health charities there promoting their cause, promoting their activities, engaging with the walkers, and I encourage all of you to have a stall and be there as well. There's no charge, and you're in front of 2,000-3,000 people. And why I encourage that is because the people that come down to the event, right, they get inspired by what we do. They get moved by the activities. We break the stigma. It's a stigma reducing event. That's what it is, and it's a connection event. We have so many, I have so many mixed wives that will come to me and go, this is the best event. I brought my husband who didn't want to get out of the house for 6 months. He came down and he came up to me and said, thank you, I feel like I'm not alone. And I feel like we're part of a bigger picture, and it helped them then get them onto the road of recovery. Parents that bring their kids down to actually help them get the conversation started with their kids. But also a sense of giving back to mental health. I've actually got a number of fathers will come to me and share with me that their daughter took their life, and they come to this event as a way to give back to mental health. But where I'm going with this is that the event, these people are able to connect with these other charities that we can't help. So I can't help 3,000 people, but there's a Sunrise Centre that does free counselling, and parents were able to go across. It's like a big expo, a business expo, right? They'll go around to each of the charities and talk to them and go, hey, I've got a situation with my kid or situation with my husband. And they're like, yeah, we can help you there. Can we book you in for an appointment? Bang, straight away, done. So we can't do that. So it's a lead generator for you guys from helping people, but also for us, we're just so blessed that we can just try and help as many people in the group as possible to get the support that they do. So I really encourage you to try and get there on the day, have a marquee set up and be involved in the event. We give away a lot of our money too, so which, it's really hard when you run a budget and then at the end of the year you got no money and you go, oh, cool, how are we going to pay for all this year? So, a high percentage of the dollar we raise. So we give away hundreds of thousands of dollars every year to you guys. So if there's charities in the room here that we've given money to, we give anywhere between $5,000 to $25,000 to help you guys. So I'd encourage you, if you're a small to medium-sized charity, jump on our website and put an application in there, and we'll give you the money. So we don't keep it. So we've even got our own programs that get pushed down because we realise you guys are fantastic at what you do. So we facilitate the money to you guys to help you guys keep doing the great work you're doing, if you're in the trenches and helping people. So, yeah, it's a community event. It's a fun, exciting event. Look, we need more people to get involved. We need more support, so we need schools. We're great at the corporate things. Raymond comes from a corporate background, so do I. So I can get in front of corporates and get the money from them. It's easy, but getting schools and government involvement, that's a part I can't seem to get through to. So we would love your help in that. The premiere, yeah, great, yeah, which is fantastic. First time in 15 years to get someone like that down there, which for us is fantastic. So, I don't know, did I touch on what you wanted, or I carried on? But
No,
yeah, so
it's excellent. Checkup's got a
yeah.
team walking.
Yes, great.
David, you're walking.
Yeah, and I do.
Eliza, yep.
I do want to say we've stolen Miss Cummings' design and implemented that into our shirt this year, our first time. So our 15th year is a big First Nations inspired walk. So the shirt is just a fully this beautiful design. So all over, and it looks amazing.
The artist, her name is Leah Cummins.
Yes.
She designed that a couple of years ago. We've been using that artwork for the last few years. It was a little bit, I don't know, radical at the time to have Indigenous artwork for a mainstream event, but the working group said, yes, let's just do it, and it's really
it's
proven
powerful.
to
The
be-
message on the shirt is beautiful. So
I'm looking forward to seeing the shirts.
yeah.
So thank you.
Sorry,
Tuna.
David, can I,
Yep.
sorry, when is the event?
So yeah, so it's on the Sunday, the 12th of October. So
Sunday,
it
12th.
normally is the official opening to Queensland Mental Health Week on the 4th, but because I think it's a long weekend, is that right? Yeah. So we find long weekends don't tend to pull crowds, so we've moved it to the end of the week. So the closing ceremony to Queensland Mental Health Week, you know. So
Yep, we have a question.
Just quickly ask, what are your contact details? How do people contact you to, support what you're doing or join the walk? Is it mental health awareness? We Google that, or what?
yeah, so obviously it's probably
We'll
not the
send it
best
around.
advertising, but go to the Mental Awareness Foundation page, and then, or you can just go to walkforawareness.org.au, and you can jump on there and register a team. However, if you do want to get a stall there on the day to promote your business and your charity and your services, I fully encourage that, because you will get inundated by people and leads and support. That person right there, Raywin Bailey, get her on the break and get, but get in and get the connection and get the email set up, and then get on the list. So please, I'd love all of you down there. So I have to jump in the ring with Raywin and debate that. But she's saying no, I'm saying yes. Okay, more the merrier. Yeah. Well, what? Yeah, she'd be like, "Why did you say that?"
Thanks so
We'll
much,
work it
Chica.
out,
That's
yeah.
great.
Where is it? You've got the bridge in the background.
Yeah,
Good point.
good question. Yeah, Captain Burke Park down there under the bridge at Captain Burke Park at Kangaroo Point, underneath the Story Bridge. We're the only event held there throughout the whole year. It's a symbolic location for us because you've got the Brisbane Bridge, and it encompasses the beautiful Brisbane River Loop. So you go all the way down to South Bank over. Until the bridge shut, you go up and over the Story Bridge and back down. But now we've got to go down, turn around over that new stilts bridge back, and then back in that way. So it's an easy walk. It's dog friendly, pram friendly. We've got wheelchair friendly. It's a festival. So if you can imagine, we've got stilt walkers, bands, marching bands. It's a celebration of life.
Are you
So
the MC on the
yeah.
All right,
We've got jets flying over. Yeah. So
But
choppers.
I'd like to
Sorry,
thank the Mental
sorry, your
Awareness
time.
Foundation for donating a Fitbit this year as a prize for the first 100 organisations who register their Queensland Mental Health Week event go into a draw to win a Fitbit. So thank you to Mental Awareness Foundation for that.
Thank you.
And finally, we've got
Your 30
Tia
seconds.
Delali from Richmond Fellowship Queensland to talk about the art exhibition.
Yes, thank you. So my name's Taya. I'm from Richmond Fellowship Queensland. We've worked with quite a lot of people in this room here, but this year we have the 34th annual Recovered Futures Art Exhibition. So it'll be held between the 3rd and the 8th of October. So the exhibition will have over 300 works this year, and for the first time ever we've included sculptures as well. Every artist has either a living mental health challenge themselves or are a carer or family of someone who has. And artists get 85% of the sale proceeds. So it's an amazing cause. We will have a wellbeing wall outside, so people will be able to open an envelope, take a note out, and then replace it with their own. So we're hoping that that'll help with the theme of Connect this year. But we really wanted to dive extra deep into the Connect theme this year, and we are opening it up for the first time ever for volunteers at the event as well. So Richmond Fellowship Queensland are the major hosts, but we've generally staffed it with RFQ staff members, but this year we really want to get involved with the public and have volunteers come down and help connect with the artists and also with the public. We'll also have a cafe style setting outside, so you're more than welcome to come down and grab a coffee as well. We'll have plenty of activities, badge making for the kids to keep them preoccupied while the adults go around and check out the works. You know, please do come down, check it out. We are hoping to have the online gallery live within the next few weeks, so you can have a sneak preview of what's available at the exhibition.
Thanks, Taya, and it's always in our calendar. Check out a group of staff always attend that one as well. Yes.
Where is this exhibition going to be held?
In King George Square, so it'll be in a big marquee in King George Square.
I remember the year, you might not have been there, it really rained, and yeah, the marquee.
Every year.
The marquee nearly floated away the year I was.
It doesn't matter. We changed it one year to May and it still poured rain. So it's like a blessing.
At least you're undercover. Thanks so much.
worries,
I also
thank you.
noticed we've got our friends from Grow here today. Is it Odd Sock Week, or do you do Odd Sock Day?
Yeah, it's Odd Sock Day
Tomorrow. Okay, I wear odd socks most days, so I'll be participating tomorrow. But yeah, I did see some media in the last few days. So yeah, so another a big event to raise money for your organisation.
So we've had a pretty big year as far as outreach goes, and we will, as always, be participating in Vote for Awareness. Pretty sure my registration's gone through, so we will be there. Yeah, so as always, I think a lot of what has been spoken about today is stuff that aligns with our values, community mental health, you know, very people forward. And so with Odd Sock Day coming up tomorrow, it's probably a kickoff for a lot of events that we will be doing. And so, yeah, a lot of the stuff that we've heard today is very much stuff that we really believe in, and we're like, you know, really looking forward to.
Excellent. Well, thanks for coming along today. That's great.
How can we be involved in Odd Sock Day, and how does it raise money?
So for Odd Socks Day, we're just getting people to wear odd socks.
They have their own socks, or you purchase them?
You can purchase them as well, but their own socks. It's mainly raising awareness that, you know, anyone can feel odd.
Well, this is on your website, isn't it?
And getting into mental wellness. So I think the hashtag's OSD 2025. I hope I got that right. And then there's odd socks that you can buy on the website as well, which have a few of the wisdoms about.
Fantastic. And we'll send all this information around afterwards to your email. So please thank our three presenters. Thank you. That's all right, all good. And we're just about on time, but before we finish up, we'd like to hear from the sponsor, as I mentioned, of today's event, Carole Cooper from Carole Cooper Consulting. Carole brings extensive experience in organisational culture and leadership development. Mental health doesn't exist in a vacuum. It's influenced by the environments where we work and where we live. Carole's insights will remind us how workplaces and organisations can become spaces of safety, support and growth. So you're all mic'd up?
I am.
Over to you, Carole. Thank you.
Thanks, David. Thank you so much, Checker, for having me sponsor this event. It's been a real privilege and honour. You heard Ivan talk about the cost of the economy, 220 billion in Australia and Queensland, 20% of that. There's another stat which it costs Australian organisations $9 billion in absenteeism. And absenteeism is linked to all sorts of reasons, but there's a massive psychosocial and mental health reason as to why people are being absent in the workplace, and that is obviously impacting organisations. And so, as you've heard today, mental health is not in a vacuum, and as organisations, we can play a significant role in people's mental health and how we connect with them. So in my business, we go into organizations and we work with them to turn their cultures from a toxic culture to a good culture. And we hand over the good culture and then help them, if they want us to help them, which hopefully they do, to take it to a great culture. And we always start with focusing on leadership, because I have a saying that the fish rots from the head, and it all starts with the executive team and the leadership team. And so we run leadership programs within the organization to support them and help them create a culture that they want and that their people want. And then we work with them on the employee experience and the people journey and all the other things linked to people and culture. And so we heard about connection, and as a leader, if you're able to connect with your people in a way that they feel comfortable coming to talk to you, if they feel comfortable talking to their team members, if you create an environment for them where people feel good about coming into work, even though they're having lots of issues and challenges in their home life and their personal life, then you can make a real difference as an employee to your people. And so we are really proud of the work that we do. Our purpose is to make a difference to individuals and organizations, and we do that by creating great cultures. So thank you again for having me here, David, and good luck with Mental Health Week in October. I will be in Japan that week, otherwise I would be participating.
No problem.
Thank you.
You also do whole brain thinking as well. Checkup participated in that course over the last year, was it? I'm a red brain. Russell, what are you? Green. Yeah, so it was really a valuable experience for us, and it really helping us all work together. So big thank you to Carole for supporting us today. Okay, that brings us to the end of today's session. I don't think I've left anything out. So let's thank our speakers. We had Ivan, James, Emily, Karen, Taya, Tudor, and Carole. So thanks for sharing your expertise and experience today. So one final plug, make sure you jump on the Queensland Mental Health Week website, think about organising a workplace event, or perhaps you're on a P&C at a school or something like that. Think about how you can get involved. These events are quarterly. Our next event is in November in Disability Awareness Week. That's another area of Checkup's work. We have an online training program called Access for All, and I'm not chairing that day, thank goodness. Many of you will know Dinesh Palapana, the doctor from the Gold Coast. He's chairing the next session. His mum is coming along as well, who's been an amazing carer and support person for him over the years. It's always one of the highlights of the year. Dinesh came along last year as well. So that concludes the Connect for Mental Health session. Thank you to the people in the room. Please stay and have some lunch and networking. And to the people online, thank you for tuning in today. Thanks everyone. Bye-bye.